Bismillahirrahmanirrahim. Hadith of the day, the Prophet Muhammad, peace be upon him, said, seeking knowledge is an obligation upon every Muslim. Assalamu alaikum, everyone. I am Dr. Marina Akhtar, PGR Community Medicine. Today, I am critically appraising on the topic clinical features, hospitalization, and death associated with monkeypox, a systematic review and meta-analysis. I am presenting this topic under the kind supervision of my professor, Dr. Saira Akhtar. Checklist. PRISMA checklist will be used for this critical appraisal. This is the screenshot of PRISMA checklist. Title: Clinical features, hospitalization, and death associated with monkeypox, a systematic review and meta-analysis. And according to PRISMA checklist, title is Identify the report as a systematic review. The title clearly identifies the study as a systematic review and meta-analysis. Abstract. A multi-country monkeypox disease outbreak began in May 2022 in Europe, leading to an assessment as a potential public health emergency of international concern on June 23, 2022. From observational studies have partially characterized clinical features, hospitalization, and death. However, no systematic review of this monkeypox outbreak was published. And the conclusion is monkeypox is spreading rapidly with third of hospitalized patients, but less than 5% with fatal outcome. As this is zoonotic virus spread globally, countries must urgently prepare human resources, infrastructure, and facilities to treat patients according to emerging guidelines and the most reliable clinical information. And according to the PRISMA 2020 checklist for abstract, the abstract provides a structured summary including background, objective, eligibility criteria, data source, study selection process, data item extracted, synthesis method results, risk of bias, conclusion, and implication. Limitations of evidence are present, and limitations of evidence, funding, and registration are not mentioned in abstract, but mentioned in further in the article. Introduction. Rationale: monkeypox virus and orthopox virus is a genus that includes smallpox virus. This emerging zoonotic agent was discovered in 1958. Denmark upon laboratory monkey, but had been causing human disease since 1970 and in endemic countries in Africa. The pathogen caused two clinical stage illness, including the prodrome during a invasive period and a cutaneous phase defined as a skin eruption. Although systematic reviews and meta-analysis usually include randomized clinical trials and aim to provide a more precise estimate of the effect of treatment or the risk factor of the disease, they also have been extensively used, especially during the last decade, to synthesize observational studies. However, RTCs are not feasible or available in many situations, and only data from observational studies are accessible. And that is the cause for clinical hospitalization and outcome feature of monkeypox. Objective: to summarize the clinical feature of monkeypox reported in currently available observational studies, to assess the clinical spectrum of the cutaneous manifestations and their frequency, and to examine the outcomes of monkeypox cases, including the proportion of patients required hospitalization, those with fatal outcomes. And this is the PRISMA checklist about introduction, rationale, and objective. Background and rationale was given, yes, clearly mention the objectives. Methods. In the methods, protocol and registration are given, and database and search strategy. A comprehensive search about the prevalence of clinical manifestation, characteristics of the lesion, and complications of the patient diagnosed with monkeypox was conducted in June 7, 2022 through following database: PubMed, Scopus, Embase, Ovid Medline, and Web of the Science. No restriction regarding language or publication date were applied. Study selection and data extraction. This systematic review had a comprehensive scope, including the subsequent observational studies, cross-sectional cohort, case control, case report, case series. In addition, studies assessing the prevalence of the various clinical manifestation characteristics of lesion complications of the patient with a probable or confirmed monkeypox diagnosis regardless of age were included. And exclusion criteria is the definition of possible and confirmed cases for each study are described in additional case series with more than 10 cases were included in the qualitative and quantitative synthesis. However, studies with less than 10 were included only in the qualitative synthesis. Scoping reviews, narrative reviews, systematic reviews, and conference abstracts were excluded from the study. Risk of bias is also mentioned in the methods we use. The original Newcastle Ottawa State NOS and JBI checklist for case reports and checklist for case series respectively. Assessment of publication bias is also mentioned, and statistical approach is also mentioned. The information collected from the included articles were combined using FCATA 16.0. We conducted a pooled analysis of various clinical manifestation characteristics of lesion and complication of the patient with probable confirmed monkeypox. A random effect model was used for quantitative analysis. The 95% confidence interval for promotion reported in each day were calculated using Pearson method. And this is the checklist, PRISMA checklist for methods. It specified detailed inclusion-exclusion criteria, how study was grouped for analysis. It listed all databases, search, and other sources for study identification. It presented full search strategies for all databases, including filter use. And it specified methods for data collection from the studies clearly and defined all outcomes data extracted. It listed all studies variable extracted like participants and intervention characteristics. But this article does not mention if all compatible results were sought for each outcome. Describe the process for assessing the study risk of bias, including tools were used, NOC and JBI checklist, number of reviews, and independence. It specified effect measures used to synthesize or present a result for each outcome. It explained methods to determine study eligibility for each synthesis. It described data preparation method. It described methods for tabulating, displaying, and synthesizing result and rationale for the choice of meta-analysis model and provide software use, but not described methods for exploring cause of heterogeneity and conducting heterogeneity. Sensitivity analysis are mentioned. Specified method for assessing risk of bias due to missing result, not describe the method for assessing certainty of evidence. Now coming to the results section, this is a PRISMA flow diagram, and in the end only 12 quantitative studies are used in meta-analysis and 19 qualitative studies are used in this research but not in meta-analysis. This is the table 1 in which symptoms are mentioned in monkeypox, and this is table 2 of data extraction table of studies, and this is the forest plot of our results and all studies. And then the results are monkeypox clinical findings regarding the clinical manifestation: rash 93%, 95% confidence interval 80 to 100%, and fever 72%, 95% confidence interval 30 to 90%, pertussis 65%, and lymphadenopathy, 62%, were among the most prevalent clinical manifestations. And cutaneous lesion characteristics of monkeypox: the cutaneous lesion were mostly monomorphic, 79%, and instead of pleomorphic, 38%, with a centrifugal distribution rather than centripetal distribution. These are more present on arms, hands, and palms. And most prevalent complications are secondary bacterial skin infection, 18%, hospitalization, 18%, and ulcer and necrotic lesions. This is the PRISMA checklist for results. For each synthesis summarizes characteristics but not the risk of bias of contributing studies were mentioned. It presented results for all statistical syntheses conducted, including summary estimates and measures of heterogeneity. It presented result of all sensitivity analysis assessing robustness of findings. It presented assessment of the risk of bias due to missing result for each synthesis. It presented assessment of certainty of evidence for each outcome. It presented study selection results via flow diagram from record identified to study included and list studies excluded after full text screening with reasons. It described characteristics of included studies in text and tables and graphs. As for a start, I have pasted the screenshot. For all outcomes, present summary statistics, effect estimates, and precision for each study in structure tables and forest plot is present. Now coming to the discussion section. Over the last month, more than 18,000 cases of monkeypox have been reported outside the Africa, the more than 70 countries up to July 27, 2022. For the first time, more than 5 decades since the virus was first detected in humans. Monkeypox is an emerging condition outside the endemic countries, rapidly spreading the multiple countries and continents due to different factors, including the potential sexual transmission, preparedness in different levels, facing a new clinical disease demands efforts in epidemiological, diagnostic, therapeutic, and preventive fields during the potential pandemic threatening to spread on new territories and areas with the risk of epidemic. The result of this systematic review highlight the findings that may assist clinicians, however, in the globe in suspecting the possibility of monkeypox infection in those with recent travel to the areas with ongoing transmission or among contact of confirmed cases according to global and national definitions. Early recognition of the cases will allow clinicians to ensure adequate clinical monitoring, supportive interventions, and preventing further transmission by implementing infection control measures. There is a need for prospective studies to evaluate epidemiology, pathogenesis, duration of viral shedding, and clinical spectrum of disease associated with this zoonotic emerging viral infection to effectively protect population and healthcare workers in the face of the arrival and spreading of this emerging viral pathogen. Constant evaluation of available evidence is essential to guide clinical suspicion, diagnosis, management, and mitigation of transmission of monkeypox. And limitations. This review has several limitations. First, few studies are available for inclusion. Most are from America and Europe. It would be better to include as many studies with the broad geographic scope of to understand monkeypox comprehensively. More detailed patient information, particularly regarding clinical outcomes, were unavailable in many studies at the time of analysis. However, the data in the review allow a first synthesis of clinical characteristics of monkeypox. Finally, possible heterogeneity of studies included should be considered for different variables. Additionally, we could not identify detailed information from the patient for many variables. In addition, the variability of population, including their nationality, origin, or belonging to some specific ethnicity and other epidemiological aspects that they could possess as well as differences in the design of study review. And this is the PRISMA checklist for discussion section. And our comments are, this article interpreted results in context of prior evidence, and this discussed limitation for included studies, also discussed limitations for review methods, also discussed implications for practice, policy, and research, and other information. Other information are given in this article are acknowledgement, that is none, and author contribution, and funding. Funding is also mentioned, and others are ethical approval and consent to participate. Approval was not required, and competing interest. All authors report no potential conflict except AJRM. AJRM is Deputy Editor-in-Chief of Annals of Clinical Microbiology and Antimicrobials. All authors have submitted the ICMJE form for disclosure of potential, and the other author details are also given. And the PRISMA checklist for other informations is given, and my comments are, it provided registration detail including registration number, link to protocol, notes protocol, amendments mentioned in method section but not in other knowledge section. Describe source for support and role for funders, declares competing interest of authors, ethical approval is not needed, they said. Now the strength of this article is the clearly defined research objective and eligibility criteria, comprehensive search strategy across 5 databases without restrictions, rigorous study selection, data extraction, and quality assessment done in duplicate, bias was assessed, limitations were mentioned. Tabular and graphical representations of results are present, adherence to PRISMA reporting guidelines, inclusion of studies from multiple countries in multiple languages. It provides first meta-analysis on this topic, as they said. Limitations. Only small number of studies, only 12 studies were included in the meta-analysis. Most studies were from Africa and Europe. It would be better to include as many as studies with a broad geographical scope to understand monkeypox comprehensively. More detailed patient information, and particularly regarding clinical outcomes, was unavailable in many studies. Possible heterogeneity of study included was not considered for different variables. And these were my this is YouTube link of our channel. Kindly like and subscribe, and thank you.